this month or this week for sure. Is there anything that you wanted to sort of say on that?
Well, I agree exactly with what you just said, Danielle, that there's the particular case of police brutality was appalling and should be condemned by everybody. And there is obviously a reality of police brutality in the U.S. and of a long history of racism. Period, paragraph. At the same time, that should in no way justify political violence, including anarchy and looting, that in many cases is destroying minority-owned businesses and neighborhoods. And I think the mayor of Atlanta put it most brilliantly this weekend when she said that all these looters are doing is burning down their own community, and this is not in the spirit of Martin Luther King or of civil rights. So I agree with those who raised their strongest objections to what happened, to what set this off, and I also agree with those who are opposed to the kind of rioting that is taking lives and destroying livelihoods in an indiscriminate way. I would just ask if people intend to attend protests here in Alberta, that first of all, we would generally discourage that during the pandemic. We recognize a right to protest, but if they do gather, please try to keep a safe distance from each other, because we don't want to create super spreader events that could undermine the progress we've made in stopping the spread of COVID-19.
All right, and hopefully it will stay peaceful as well. Let's talk about COVID, because there's a lot to talk about there. And I know that there was a speech that you gave in the legislature last week, which I felt was really trying to change the tone and put some perspective around it. But it certainly got a reaction from Gil McGowan and others. I want to play the clip last week, and then we'll talk about what it is that you were intending to do there. Courtney, that's clip number 1. Courtney, have you got that clip?
It is critical as we move forward that we focus our efforts on the most vulnerable, on the elderly and the immunocompromised. The average age of death from COVID in Alberta is 83. And I remind the House that the average life expectancy in the province is age 82. And so in Canada, 95% of fatalities are from COVID are for those over the age of 60. 80% are in care facilities, and the risk of death from COVID for people under the age of 65 is 0.0006%.
Okay. So Gil McGowan had a very strong reaction to that, and so did some folks on Twitter. I think they were suggesting that somehow you were changing the message and not acknowledging the significant outbreaks that have occurred at places like Cargill and other large production facilities. What was it you were trying to do with that statement you made last week?
Well, Danielle, we're always told that policy should be based on evidence and data. And I was, I think we should treat Albertans with all of the facts as mature grown-ups who can sort through the facts and draw reasonable inferences. In this case, the inference is clearly that we must focus our efforts on COVID-19, on protecting the most vulnerable. There is a very, very close correlation between this disease and age. As people age, they become much more vulnerable to the disease. And as I said, 80% of the deaths related to COVID-19 in Canada and in many other jurisdictions around the world, including here in Alberta, have been residents of nursing homes and similar seniors facilities. So as we move forward, we need to learn from that, and we need to focus our defensive measures more and more on protecting the vulnerable. I would also offer those statistics to reassure some people who believe that it's irresponsible for us to relaunch areas of the economy that have been impaired by public health measures. There are some people who are very nervous about their kids going back to school in September, for example. In some jurisdictions, we've seen teachers' unions refuse to go back to work for that reason. And so I'm trying to, through the data and the facts, bring balance to the debate to point out that we can safely re-engage in economic and social activity that's critical to our livelihoods and to our life together, to our mental health, to people's mental health, their well-being, their livelihoods. We can do all of those things with taking reasonable precautions in a gradual, thoughtful, and prudent way You mentioned Mr. McGowan. He wants us to shut down the entire economy for another month. And part of my point here is that severe public health measures, like, for example, shutting down, indefinitely suspending surgeries, blocking out thousands of hospital rooms, acute care beds, suspending hundreds of thousands of jobs in the economy. All of these things have significant both physical and mental health implications. So we need to take a thoughtful approach. And in my view, that means continuing to limit the spread through common sense public health measures, following the advice of our chief medical officer. It also means focusing efforts in the future increasingly on protecting the vulnerable. You know, all of what we've done over the past 10 weeks, in part, was to buy time. Buy time to flatten the curve and defend the health system from being overwhelmed like it was in some places. Buy time to educate the public about the need for rigorous hygiene and the distancing measures. Buy time for the scientists to make progress, hopefully on a vaccine or effective treatments. Buy time to learn more about the disease. And one of the things we have learned is that the very elderly are particularly vulnerable to it, and that's where I think our primary focus must be.
I think I would fall on the other side. I'm worried that at the slightest increase, we're going to see another clampdown and lockdown on all of the businesses who have done everything they could to put in new measures. We do have the capacity in the hospitals now and in the ICU and with ventilators and with masks. Can you foresee anything that would cause us to switch course 100%, go 180 and go back to the lockdown?
Well, first of all, I broadly share your concern, and that's what I said in my speech last week in the legislature. I said I'm challenging our officials, our public health experts, if we do see outbreaks in the future, we must focus our policy response on protecting the most vulnerable rather than indiscriminately damaging our whole society because of all of the other physical and mental impacts that can have, as I pointed out. So I for one, would be very reluctant to do that because we have flattened the curve. We have now, I think, 45 people in acute care beds with COVID-19, about 5 in ICU beds. So we're at about 4% of the set-aside capacity in the healthcare system. By the way, at the height of this, Danielle, we had set aside 2,800 acute care hospital beds. We're down now to 1,000 because we've done so well as Albertans. And we should celebrate the personal responsibility. This is another key point, Danielle. Alberta has taken a lighter touch in terms of public health measures and restrictions than anywhere in Canada. And one of the least stringent regulatory approaches on COVID-19 in the Western world, and yet we have by far better results. We have, amongst the major Canadian provinces, the lowest per capita rates of hospitalizations, ICU admissions, and COVID-related deaths, and much, much lower than in many places in the United States and Europe, for example. We've done that without lockdowns, without impairing most of the economy. Our public health orders did suspend about 15% of businesses, but 85% were able to continue operating within certain health care parameters. And I'm just, so what I'm trying to convey is the progress we've made was because we trusted people to act responsibly, and that approach I hope will continue to govern our policy in the future.
Can you tell us what happens when the public health order ends? I believe it's on June 14th. I'm a bit confused because I don't know if that means that the phase 2 and phase 3 orders and the delays in reopening some businesses continues, or do you need to extend that public health order in order to continue those restrictions?
No, many of those restrictions would continue to operate for 60 days after the lapsing of a public health emergency, and many of those powers can operate outside of a public health emergency. The main reason that we brought in a public health emergency back on March 17th on the advice of the chief medical officer was to give us the power to manage human resources in the healthcare system if we were overwhelmed in the same way that Italy, New York, or Spain was. So we could overcome, during that emergency, for example, restrictions on shifts through collective bargaining agreements and things like that. So that was the primary purpose of the public health emergency. But under the Public Health Act, there are broader measures that we can and will continue to take. As you know, we have this phased approach, and that's the approach we'll continue to take.
How are you building in international evidence into our approach here. I'm just reading this Reuters story about a doctor right in the center of the crisis in Milan saying that the new coronavirus is losing its potency. It's become much less lethal. He gave this interview on Sunday. He said, in reality, the virus clinically no longer exists in Italy. The swabs that were performed over the last 10 days show a viral load in quantitative terms that was absolutely infinitesimal compared to the ones carried out a month or 2 months ago. I don't think this would be unusual. I think we sort of saw the same thing with SARS, surprisingly. It emerged, there was an outbreak, and then it kind of disappeared. So if this turns out to be the case, how does that get worked into our plan here in Alberta?
Well, I personally spend all through the last 10 weeks, I spend a lot of my weekends reading reports and studies and of that nature and looking at data. And I know that our public health branch at the Health Department of Health is obviously constantly following the international research. And I think that's one of the reasons that we feel confident in moving prudently forward with our relaunch. We see those trends, and we do know, Danielle, historically, that diseases of this nature tend to abate in the summer months, right? But we have to continue to be vigilant. I don't want folks, Danielle, thinking that this is all over and we can just let her rip and go right back to normal and ignore all of the things about physical distancing and frequent hand washing, all those good habits we've developed. Because this could, we have seen subsequent outbreaks in countries where they thought they had beat this thing, in Singapore and South Korea. In other places, they've seen subsequent waves. And it is not inconceivable that if we were to completely let down our guard, that we would see a huge surge in cases that could challenge the capacity of our health system. So let's not put ourselves in that position. Let's be careful and prudent about this. But part of the message I was trying to convey to Albertans last week is let's do this in a balanced way. We can, let's get out in the sun and enjoy the Alberta summer. Let's patronize those businesses that are operating and open now. Let's do it in a safe way. And let's be careful in the fall because, as we know from the experience of, for example, the Spanish flu in 1918, 1919, it really abated in the summer and came back ferociously in the fall. So that's why we're going to have to continue to be vigilant, but within reason.
Okay, I think you also took a little bit of heat because in your speech you talked about how influenzas abate over the summer, and so a lot of people were saying, "Well, you should know this isn't influenza." What did you mean when you referred to influenzas?
Well, look, a coronavirus is different in many respects than a flu influenza, but there are also a lot of common characteristics. These are both communicable diseases with similar patterns of spread, and most of the pandemics that we look to historically on which to base our models and our policy response have been influenza pandemics. And in fact, Danielle, for legal purposes, I don't think many people understand this, but for legal purposes, this was declared to be a influenza pandemic by the Lieutenant Governor and Council on the advice of the Chief Medical Officer for Health through a order in council on March 17 under Section 52 of the Public Health Act. So most of our experience, our legal tools relate to influenza pandemics, and that's why it was publicly or legally declared on the advice of the Chief Medical Officer to be an influenza pandemic. But I don't expect the anger machine on the left of Twitter to understand that level of nuance.
Okay, well, thank you for clarifying on that. A couple of things. I'm getting all kinds of heartbreaking stories from people who've had their surgeries delayed. One woman in particular who doesn't want me to name her name, she's afraid of complaining because she thinks it'll push her further down on the list. She needs a knee replacement. People who haven't had cancer tests, people who have resisted going to the hospital for heart and stroke. Number one, are you keeping track of any of these statistics about what some of the alternative health effects have been from the shutdown? And how do we avoid this in future? Like if there's a second outbreak, does every single hospital have to be turned over 100% to coronavirus?
The answers are yes and no. We have been tracking non-COVID related health data, including other morbidities that are non-COVID related, to see if there's been a spike in those, as well as particularly suicides, because obviously we've been concerned that the pressure of all of this, together with the economic consequences, we fully expect is going to result in a lot of mental health problems, and that often manifests itself as suicide, tragically. I can tell you that to date, we have not seen any increase in non-COVID related morbidities beyond what you would normally see it over the past 3 months historically, and in fact, we've seen a slight decrease in the number of suicides on average per month compared to the last few years. Now we're not, but Danielle, you're right to raise these questions. We're tracking that very closely, and quite frankly, this is what was one of the points of my speech to the legislature last week. This is one of the reasons we must move forward prudently, but with confidence to relaunch, because inevitably, blocking all sorts of other non-COVID health care and surgery will have an impact, and this stuff will have an impact on people's mental health, which is why we've surged additional support for mental health. So that's why I've said that I believe we need to focus on effective measures to protect the most vulnerable, who tend to be the very elderly and those with other pre-existing health conditions, as opposed to indiscriminately impairing the social and economic lives of millions of people.
What is the next phase in getting families reconnected with their loved ones in long-term care? Because it's a really tragic environment, and the tragic stories I'm hearing as well of people wanting to see their loved ones. They may not have much time left, and they're terrified they're actually not going to spend much time with them before they die of other illnesses.
You put your finger on one of the things that really concerns me most. Because when we talk about protecting the most vulnerable, obviously that means limiting the number of people who come into nursing homes and similar congregate seniors facilities. And yet, obviously, given the age of those residents, many of them are in their last years of life, and we want to ensure they have a quality of life, and that includes being able to interact with their loved ones. And I've heard stories about citizens on the other side of that tension who are angry at seniors' residences and nursing homes for allowing their moms and dads or grandparents out of their rooms. So, or telling their parents that they're not allowed to leave their homes, their private homes. So this is a really difficult tension. We're going to have to work this out, Danielle, because I think your point is totally valid. Now, by the way, Dr. Hinshaw, following a discussion at our Emergency Management Cabinet Committee about 4 or 5 weeks ago, did issue additional guidelines for the operators of nursing homes and similar places, making it clear that compassionate visits from loved ones towards the end of life are not only permitted, but she encouraged the managers of those facilities to show common sense and compassion in handling those situations. So I don't think we've found exactly the right balance. The goal has to be a balanced one. It's not just about but one thing we can't afford, Danielle, we cannot afford the virus to run loose in seniors' homes, and so in nursing homes. And so every reasonable precaution must be taken, but those precautions must be balanced with quality of life.
Okay, my firearms owners are going to be upset if I don't pose this question to you before we run out of time. What are you going to do about this massive firearms ban? It's turned literally millions of legal firearms owners into criminals overnight.
Well, we will be creating a Alberta Chief Firearms Officer under the federal legislation, and we are strongly opposed to this indiscriminate action by the federal government. It does nothing to tackle the real problem, which is the smuggling of huge amounts of illegal firearms across the U.S. border. If the federal government was remotely serious about this, they would massively increase resources for the interdiction of smuggled firearms across the U.S. border, not criminalize firearms that have always been legal and which are responsibly controlled by people who have gone through the registration process, who have their firearms owner certificate, and so this is I think it's completely about political optics. It seeks to criminalize law-abiding people rather than focus on the actual illegal firearms that are causing violence, primarily through drug gangs on our streets.
Are you going to challenge it legally?
We may come in behind to support a firearms owner. There are a number of a constitutional challenge or legal challenges we believe that are pending. We think that with those challenges that have a better chance of success if they were brought forward by somebody who's directly affected as opposed to a provincial government. As you know, Danielle, the courts have consistently said that the regulation of firearms is a exclusive federal jurisdiction, although provinces do have responsibilities, you know, to enforce criminal law. It's under that power that we'll be creating an Alberta Chief Firearms Officer. But we will certainly consider, we're keeping our options open to support an individual firearms owner who does challenge this. And I've been reading some legal opinions which suggest I think that the federal government has overreached here in terms of their legal powers.
Excellent. Last one, just really quickly. The Greenline debate is taking place at City Council. They've got half the line at essentially the same cost. I know that when you were a federal minister, you advocated on behalf of that project. I think they're worried that if they modify it to only allow a BRT going north and the train going south, that somehow that will put provincial funding at risk. Would you pull the funding if they change the project to actually make it make sense?
I am very interested in that proposal, and I've always been, let me put it this way, Daniel, back in 2015 when I was the federal minister for Alberta, I committed $1.5 billion federal dollars for the LRT, which was supposed to go, I think, 45 clicks from the far north to the far southeast. And then eventually it shrunk in half at twice the cost. And I gather that was primarily because of extensive tunneling downtown. And so the further out suburbs, who are the people that are supposed to be served by this, got cut out altogether. So I'm glad they're taking a different look at this, and we'd be happy to get into conversations with the city about it. Excellent.
Thanks so much for your time today, Premier. Sure appreciate it.
Thanks, Danielle.
That was the Premier of Alberta, Jason Kenney. Take a pause. Be back after news on 770 CHQR. The 8 Manor Village Life Centers would like to recognize their 830 frontline workers who are helping seniors in our